Good morning. I'm George Latimer, Westchester County Executive, and here in downtown White Plains, we are launching an important program here in Westchester County, and I'm joined by many people from inside and outside the government and the medical community to announce Westchester County's commitment to maternal health, particularly among those in the African American community. You will hear today from a number of important speakers. Dr. Charlita Amler, who is our Commissioner of Health, will be speaking at this press event. We have Cheryl Brannan, who's the founder of Sister to Sister International, will be with us. And I have to add, with a lot of Westchester pride, that she was at last night's State of the Union address in Washington, D.C. with the President of the United States. And she's one of the first people to be here this morning, having been in Washington last night. And she will also recognize some of our community partners who are here with us today. Dr. Angela Campbell is with us. She's the Executive Director of the Lower Hudson Valley Prenatal Network. We have Dr. Kay Scott joining us, who's Associate Vice President, Grants Management of the Hope Center at St. John's Riverside Hospital. And we also have with us Nubia Earth Martin, who's the founder of Birth from the Earth. And each of them have an important element to talk about in terms of this program and the investments involved. I'm joined, as I always am, by our terrific Deputy County Executive, Ken Jenkins, who's with us. And we have two members of the Westchester County Board of Legislators who are here on behalf of their colleagues as well. We have Jewel Williams-Johnson, who heads the relevant committee on the Board of Legislators, and also the Vice Chair of the Board of Legislators, Nancy Barr, is with us as well. There's some other people as well I just want to introduce right at the outset. Robbie Schlaff is with us here, our Executive Director for the Office of Women, and she has been involved in numerous programs that involve health care and other programs and benefits for women all across the county. Robbie, thank you for your leadership. We're also joined by Diane Atkins, who's a member of our senior executive team, and she is one of the prominent advocates for these issues. Diane and I know each other for a long time, and I'm very fortunate to have her part of our executive team. Also with us is Ellen Hendricks, who is a town councilwoman in Greenburgh by night, but by the day she's our Director of Research on our executive team. And we have other important individuals who are part of this. Very briefly, because I'm going to let our guests really lay out the element of this, Westchester County is making an investment that we think is a critical investment. It attempts to join the money that Senator Chuck Schumer has been able to allocate from the federal government to address this issue, which we think is critical, and that's black maternal child and maternal health care as part of the process of birthing. There is no man that can understand what a woman goes through in childbirth. As close as we are to the birth of children, we can't possibly understand it on a personal level. And I must say that being a person who's white, it is not possible for me to understand what the experience is for a person who's black. And I might add in other demographics, people of color, and what they go through in the healthcare system that is complicated as it is in the best of circumstances and expensive as it is in the best of circumstances. But we do know that the outcomes have not been good for black women through their pregnancy and delivery. And we want that to get better. To that end, we've allocated almost $1 million of county funds this year, and we see this as the beginning of an investment, not the completion of the investment. We're knowing that the federal government has taken steps in this direction, and the state government as well. And to do that under the leadership of people whose leadership we trust in the medical profession, you'll hear from Dr. Campbell, Dr. Scott in a few seconds, and from advocates like Cheryl Brannan, who have made this a significant part of what their public advocacy is. So I'd first like to introduce our Commissioner of Health, Dr. Charlita Amler. She has been our advisor and leader on all matters relating to health. And as you know, through the COVID crisis, the rise of the concerns about monkeypox and polio and other both communicable diseases and things that we have to deal with over a long period of time, she has been a great leader for us. So Dr. Amler, we're very happy to have that leadership and appreciate you speaking next.
Thank you. Usually when I'm up here to talk about some dread disease, but today we have a happy topic to talk about, which is maternal health and hopefully the birth of healthy babies and mothers doing well. So as the county executive was saying, health disparity among Black women and women of color is our primary concern. And often this disparity starts before the birth of the baby. So those issues can last a lifetime and can often lead to a shorter lifespan, both in Westchester and nationwide. Black mothers are nearly 4 times as likely to deliver preterm babies as other mothers in Westchester. And by collaborating with Birth to Earth, St. John's Riverside Hospital, the Lower Hudson Valley Perinatal Network, and with assistance from Sister to Sister International, we hope to help Black mothers and infants make measurable improvements to their health by assuring that they have access to quality care before and after birth. And focusing on health equity and improving health outcomes for all mothers is a very important goal for the Westchester County Department of Health, and I know for the county executive and the county as a whole, but especially for Black mothers and babies who are disproportionately affected by economic and racial inequities. So we are thrilled, and this has been a long time coming, and we really are thrilled to launch this partnership to work together to reduce disparities, to educate, inform, and increase healthcare access for county residents as they strive to achieve improved health, not just for themselves, but for their families as well. And I would like to express my appreciation to some members of my staff who've worked very hard on this project, and that would be my first deputy, Renee Recchia. Yes. She really deserved the recognition. Ashley Hardesty and Elizabeth Dole. And I would also like to thank Jolly, who is our lead epidemiologist, who helps us with the numbers. So thank you.
Thank you very much, Dr. Amler. I'd also like to recognize one of the key members of our executive team who's here today, whose involvement in almost every issue of public policy is essential, along with Joan McDonald, who serves as our Director of Operations. Emily Saltzman is our Deputy Director of Operations. And I can't tell you how many times I stand up as the face of the government, knowing that it's people like Ken Jenkins, Joan McDonald, Emily Saltzman, Catherine Chaffee, John Nona, Steve Bass, that really have done the heavy lifting that make these advances possible. And so I'm very grateful, Emily, for your leadership in this area as well. Next, I'd like to bring to the microphone Cheryl Brannan, who is founder of Sister to Sister International. She's been a longtime advocate for Black maternal health. She has recently worked to establish the Black Maternal and Child Care Center for Excellence in Yonkers. But as I said previously, her scope is not just in one city, and of course for our purposes across the county, but it really is a statewide and now a nationwide recognition for what she has to do. So I'd very much like for her to share her thoughts at this time as we move forward in this cooperative project. Sure.
Thank you very much, County Exec Latimer. This is clearly a wonderful, wonderful day. And you mentioned I had the opportunity to participate in the wonderful State of the Union address last night, to visit at the, certainly the offer and the invite of Senator Chuck Schumer, and it was absolutely marvelous. Let me just say that for years, we've had many concerns as it relates to Black maternal health. Sister to Sister International actually did some research in 2019, and one of the pillars that we researched were health and wellness. And during that time, we found that Black women were dying at much greater lengths than their white counterparts. Additionally, we found that low birth rates were much higher, and just all kinds of issues that are in large part are preventable. So what we wanted to do was certainly create work groups, which is what we've done. And out of those work groups came some strategies. And one of those strategies was to create a Black Maternal and Child Center of Excellence. And we actually had a ribbon cutting on that back in November. And since then, we've gotten funding with our various community partners, including St. John's Riverside Hospital, including Cheryl Hunter Grant, one of our consultants, Dr. Angela Campbell, who you'll hear from in a bit, Nubia Earth Martin, certainly president and founder of Birth from the Earth, Dr. Suzanne Greenidge, who's been our medical expert, and of course Ron Cordy from St. John's Riverside Hospital. And so we're so happy to add to that list today the Westchester County Department of Health. We're so appreciative of Deputy County Executive Ken Jenkins, who's been a strong champion for us. We're so appreciative of Dr. Amler as the Commissioner of Health, who's been a strong champion, as well as you, of course, Emily Saltzman. And certainly we're delighted to have our Westchester County Board of Legislators in terms of Jewel Johnson, Nancy Barr, in addition to the Honorable Chris Johnson, who's represented here. We've got all of the bases covered. I like to call it a land, air, and sea approach, okay? And when it comes to funding, we all know you have to have funding to make these things work. Can I get an amen on that? So we were so delighted to have Senator Schumer step up and partner with us in St. John's Riverside Hospital in terms of converting and making the maternity ward much more equitable and much more aesthetic and inviting. So for people of color and especially Black women. So we're so delighted to know of that renovation. We also have some anti-bias training because we all know practitioners are not really trained. And if we go back, it's Black History Month. We know that Black women were the people that were tested on years ago for various different procedures with Dr. Sims. There's a whole history there. So we want to change that history. We want to make physicians and we want to make practitioners much more sensitive as it relates to Black women. We want them to listen to Black women. So we're advocating for that. And under our Black Maternal Center of Excellence, we've got 4 pillars. One of them is funding. I just talked about that, not only from the federal government, but state governments. New York Senate Majority Leader Andrea Stewart-Cousins is providing funding, as well as the delegation. And here in the county now, we're getting certainly funding, which we're most delighted with for. So again, just across the board. So that's one of our pillars. Our other pillar is community partners, and I talked about some of our community partners, and there are various others in the audience. The third one is education and advocacy, as well as making sure that we're counting the numbers and becoming familiar with the outcomes and what are we going to do to frame them and make change. So we've got all kinds of wonderful campaigns. We've got a Sisters Beating the Odds campaign. We've got a marvelous preeclampsia campaign. Some of you may have seen the New York Times today. There's an article on Black women and hypertension, as well as we're training women how to become self-advocates for themselves. And the list just goes on and on. Nutrition training, anti-bias training, and so on and so on. So we have an excellent conglomeration of services to help wrap our arms around women and certainly to support great outcomes. And we're most delighted, as I wrap up as well, to work with the Westchester County Department of Health, because it really is about working hand in hand. So we are also going to be working on a dashboard, and you can say amen on the dashboard, because the dashboard will be such a great opportunity for us to document our outcomes and for the general public on various different phases to have access to that information. And then, oh, by the way, to work collectively with Sister to Sister International and our Black Maternal and Child Center of Excellence to develop strategies. So again, we're most delighted to have them working with us as well. And so with that said, I think that about covers the overview of the Black Maternal and Child Center of Excellence, all of our marvelous community partners. We'll come back at the end to make some final recognitions, but in short, we really just want to say thank you. We've got a process in place. We're going to keep this train moving, and guess what? We're going to change birth outcomes in Westchester County for Black women. So with that said, I'm going to turn it back over to our industrious, marvelous, dapper. Every time I see him, I tell him how dapper he is, if you look. County Executive George Latimer. Let's give him a nice round of applause.
Thanks for those undeserved compliments. The announcement of money being spent and funded, as Cheryl said, is really one pillar. And that's much of what this press conference represents. But what really matters is the outcome. What really matters is that we move the needle and get a better result. That's why we're so hopeful about this initiative. And three of the people who are part of partner organizations that will help create the outcome that this funding will assist in are our friends that are next going to speak. I'll just introduce them each before they speak. I'll let them tell you just a little bit about themselves so you get an idea of who they are and then their message for today. First, Dr. Angela Campbell from the Lower Hudson Valley Perinatal Network. Dr. Campbell.
Good morning. So my history starts with Sister to Sister International 25 years ago. Came as, you already tell our age, right? Came as just someone interested in community partnership and understanding about education and STEAM programs, and then grew into something different. My history starts with Cheryl Hunter Grant, who taught me how to run an organization and understand that you are always there. You get up every day for those women you serve. So I thank them both for that. And of course, Robbie, who said, you know what, I want to hear more about these doulas. Tell me more, and then was able to get funding for that as well through Cheryl Hunter Grant, through Cheryl Brannan, and through Sister to Sister. I thank both of those, all three of those women. Thank you so much. At Lower Hudson Valley, we want to be permanently encouraged by the number of pregnant people that we meet each day. We want them to feel seen and heard. We want to understand that they are respected. So most importantly, we want women to feel empowered so that they understand through things like the Community Voice Exchange, which we run every month, that we are there to partnership with them, to listen to them, to not tell them what they need, but to ask them what they want. Also, we feel powerful to understand that doctors and providers have come to us for the first time in years and said, what do we need to do to partnership with you, to have a collective impact outcome? And we want to understand, physicians have asked us, in New York State, how do we assist pregnant women, birthing, and postpartum? We feel like we're birth justice warriors, and we will continue to be activated by listening to our community, by listening to our families, because that has to be the first step. Once we stop listening, we need to have a different job. And also remembering that we are thankful for this funding. We are gracious, and we thank you for being able to give us this funding so we can help these pregnant people and their families as well. We have been encouraged to start a TRIO service delivery program. And I have my doulas, my lactation specialists, and my community health workers here with us to say that we are going to have a supportive framework that all perinatal people will get to have a stress-free zone. So when you come into our organization, you're going to get a doula, you're going to get a community health worker, and you're going to get a breastfeeding specialist. This 3-member team will encourage us to elaborate and continue to partnership to understand this transformational change that we want is only available when we have all three at the table. So we will learn uniquely for the first time how to listen, as I said, but also to inspire hope in our community health workers, our lactation specialists, and our doulas so that they can be part of the change that we want in the communities we serve. So we thank you, as our ancestors have told us to exhale, to understand about truth, to know that we are here to do different work. We know that we will change birth equity in this county and in this state. Thank you.
Jockeying back and forth to the microphone, Dr. Kay Scott from St. John's Riverside Hospital.
Breathe out. Good morning, everybody. I'm so pleased to be here. I come to this path having worked 25 years with Renee in HIV and AIDS and in behavioral health. And one day I met Cheryl Brannan. So on behalf of St. John's Riverside Hospital and Ron Cordy, who is our CEO, I'm here today to say thank you to the Westchester County Department of Health and to County Executive Latimer for allowing us to participate in this and providing the funding so we can do this work. Good health is a great equalizer, and as a white woman who was born in the South, until I worked in HIV, I did not realize what not having good health care was. And from that day forward, I have been watching, and I've been lucky enough to work in a hospital where people have acknowledged the fact that while all of us in healthcare try to do the best that we can, we are beginning to really recognize the magnitude of the inequities in our communities, and COVID was one part of bringing that to the foreground. Awareness of these inequities have been magnified by all of the community-wide health emergencies, not only COVID, monkeypox, and reinforced through the awareness brought to us by our close work with our community partners who are here today. This grant will allow us the opportunity to train our staff, increase our sensitivity, as well as provide the resources to address the inequities. And it is a great opportunity for our community-based hospital to participate in this work. We feel very honored. So we thank the county, we thank the health department, we thank Sister to Sister and everyone who has worked in that. And we really thank all of our community partners who will be working with us as we go down this road. I'm going to say to all of you what you know, that change is not easy. Nobody likes change, but change is necessary. And as a hospital, we're committing to you that we're going to work with our staff to change. So I look forward to working together with all of you on this initiative to address these inequities, and the generous grant is going to allow us to begin to do that. So thank you for letting me be here today, and thank you so much.
Thank you, Dr. Scott. Next, Nubia Earth Martin, Earth from the Earth.
Greetings, good morning, everybody. I just want to first say that I am honored to be here as a community partner. I'm the president and founder of Birth from the Earth, Inc. We are a community-based grassroots organization based in Yonkers, founded in Yonkers, and just generously serving Yonkers from our heart. I'm a lifetime resident of Yonkers, so this work is near and dear to me, and pretty much everything that we have done has been born from the things that I wish I had when I was expecting my children. I had my first two at St. John's Riverside Hospital, and since 2008, we've been doing community birth work to make sure that families have the services, the access, and equitable care that they need, and partnering with organizations like Sister to Sister, partnering with Lower Hudson Valley Perinatal Network, and just kind of connecting the dots has really been an amazing journey. And we're seeing the change. You know, we have a lot of quantitative data, but the qualitative data, hearing how those families are impacted, hearing how, you know, they felt supported, they had labor support, excuse me, they had a midwife, they had an OBGYN who listened to them. These are the types of things that we're trying to impact, as well as making sure that people always have equitable care and that our maternal health rates in general improve. So we are excited to expand with these funds to make sure that we are including the entire family in maternal health. And that was one of the main messages that came through in the documentary Aftershock, that we need to make sure that fathers are involved, grandmothers, aunts, cousins, anybody who is impacted and is a part of that birthing person's prenatal care, that they're able to understand how to advocate for themselves, they're able to understand what things are offered in their community, and they're able to have access to those things. So I am optimistic as we move forward for 2023. I am excited for the things that we're going to just bring to fruition together. And I like change. I like change. I like change when it has a ripple effect that is going to, you know, empower families, empower communities, empower the society, and also empower the entire world. So I'm excited. I am revved up, and I'm honored. And thank you.
Thank you very much, Ms. Martin. We'll close in a second. I'll invite Cheryl Brannan to come back up so she can recognize the community partners a little bit more specifically. But I want to again highlight, I mentioned this in the front end, but it bears repeating, that the resources that are being allocated today, the almost $1 million, came from the budget that was adopted at the end of last year, December of last year. And I want to publicly thank the members of the Board of Legislators, Catherine Borgia, the chair, Nancy Barr, the vice chair, Chris Johnson, the majority leader, Margaret Kunzio, the minority leader, and all the other members of the board. This was passed unanimously. And keep in mind, after you saw last night, Cheryl, where half the room gets up and half the room don't get up, what we try to do, this is one of those issues, and there are other issues as well, where we try to show that the direction of this county is not subject to the usual partisan disagreements. We negotiate out so that we can have, in this case, actually, three political parties are represented in the Board of Legislators, and we get to a consensus. And if we can do that, then we have a longer-term likelihood that this is not just a one-off opportunity or a two-off opportunity, that this could be continued for years for the future. And as we see improvement in results, we know that it is money well invested. And that is obviously what we hope to be able to show over time. Generally speaking, outside of this issue, this is one of many critical, important issues. In general, this county, its government has proven over the years, long before I had this particular position, that we can be a leader in the state of New York because we see problems and we don't ignore them. And that is a bipartisan. This building's named after Republican Edward McCallion. Andrew O'Rourke, a Republican, held the position before I did. Democrats like Aldo Bello, Andy Spano did as well. And many of these things have been bipartisan commitments across politics into what is right, into what is good and fair. And keep in mind, if we can make the improvements that we talk about, and I believe we can, Westchester County has more people in it than the state of Wyoming. We have more people than the state of North Dakota or the state of Vermont or the state of Delaware. We're impacting a significant number of people if we can get this right. And I know that we can get this right. We've got the right people in place. Again, the leadership team that I'm a part of with Ken and others, and then also the partners that we have in the healthcare and in the community effort. So let me ask Cheryl Brannan to come back, close the conference by recognizing some people that deserve recognition, and then from there, let's just go do the right thing. Cheryl?
Thank you again, County Executive, and your entire team. We're very, very fortunate to live in Westchester and have a County Executive that gets it. No question about it. And it really does take a village to do this work. And all of you in here are family by one way, form, or fashion. And that said, certainly in terms of county government as well, we've certainly worked hand in hand with the Westchester County Office for Women and Robbie Schlaff, as well as Dr. Damia Harris-Madden and the pregnancy prevention, who couldn't be here, and so on. So we've really touched on all of you here. That said, certainly county government, but further, we've got some marvelous other community partners here. When I say other, they've been with us since the beginning as we certainly develop these strategies. So I want to acknowledge people like Dr. Gail Agnes, Society of Black Physicians, who's here. I want to acknowledge Colleen Brathwaite, the chair of the Westchester Women's Agenda, who's been with us shoulder to shoulder. And then certainly we have our board members, Charmaine Golden, and Chief of Staff, Tashai Amazon, STSI in the house, give them. And then the Westchester County Health Department lets us borrow great people. Isn't that exciting? So we have people certainly like Erica Williams and Jen Jones, and we've got Erica Doyle, Elizabeth Doyle, and Erica and Ashley, and the list just goes on and on. And then, of course, how could you have an event or how could you have a collaboration and not have the Delta Sigma Theta on board? So we're delighted to have with us their chairperson. And then we've got the National Council of Negro Women, certainly Linda and Effie. And then, of course, we have so many others. If you're a community partner, and how could we forget Kate Permit from Westchester Women's Agenda? Because those of you who know us, you know, when you work with us, you got to put your shoulder to the wheel. It's not name only. So certainly WWA and various others have been with us. If I have not called your name and you've been a community partner and you don't want me to walk away from here sad, I want you to stand, please. I'm a little sleep deprived. I was in Washington last night, and I just want to.
Cheryl.
I want to make sure. Absolutely, absolutely, absolutely. Yes, absolutely. And I recognize Cheryl up front because clearly she's been a strong part of our team, and we're so delighted to have her working with us across the board. So thank you so much for that. Anybody else that we may have? Okay, certainly Carla Horton and yes, Hope Store have been with us from the beginning. And yes, okay, absolutely. And I mentioned Emily earlier, but she's worth mentioning again, Emily. Okay, so is there anyone else? So happy to see all of you, because again, it really does take a village, and delighted that the county has bought off on all of our community partners, and just look forward to working together again to improve those birth outcomes. With that said, I want to say thank you again to County Exec Dr. Amler, certainly Deputy County Exec Ken Jenkins, and the entire team. Thank you very much. Have a good one. Okay.